When you have a baby, life becomes very busy very quickly, and it can be very easy to put yourself second or third, especially when it comes to postpartum rehab. But ensuring a proper recovery for yourself is essential. This video will explain what postpartum rehab is and why it's important. My name is Catherine Stone, and I'm an obstetric health physical therapist. I see women at all stages of pregnancy and after, and I'm going to explain what postpartum rehab is, why it's important, and how long it lasts. So the individual exercises and therapies that you'll do when you see a postpartum PT will vary according to your individual needs, but I want to review a few key areas that we will cover. First of all, pelvic floor, learning how to kind of retrain pelvic floor muscles that are vital for everyday function. Secondary would be postural retraining, and that's from growing a baby, having postural changes over the course of your pregnancy, and even covering postures for daily things that you're going to do now, like breastfeeding, lifting a baby. Another area we would focus on is rebuilding core strength. Depending on how you delivered, if you had a C-section, your core strength is definitely going to be affected by the surgical procedure. So we will show you how to safely rebuild core strength. And that's still true if you didn't have a C-section too. You still want to safely reintegrate core and other strengthening exercises. Another thing would be scar mobility if you did have a C-section. Sometimes you can get scar adhesions, tissue adhesions from that surgical procedure, so we can work on the scar tissue. And then lastly, we want to show you how to safely reintegrate any activity that you were doing before pregnancy into your life now, whether that's running or swimming or hiking. If you've had issues throughout your pregnancy with back pain or other painful syndromes, sometimes you get carryover even after you've had the baby. And we just want to show you how to, again, safely reintegrate some of those activities that you used to do. So the main reason that postpartum rehab is so important to do sooner rather than later is because some things that start during pregnancy or after pregnancy that are left untreated or unidentified can become way bigger problems later in life. Too many times we hear someone say, I started having this issue a few weeks after I delivered my first or my second or my third child, and here it is 10 years later, and this is the first time they're seeking treatment for it. Things are way easier to treat in the earliest stages before they become chronic or long-standing conditions. And that could even mean that you just come in a couple of times and get the tools to know how to strengthen things or get some guidance. If you feel like you can't come 2 times a week for 8 weeks after just having a baby, that's understandable. But even if you come that one time, and like I said, just get the tools that can help you relearn some muscle strengthening strategies and learn how to safely return to activities that you're doing, that can be really important. So unless your medical provider, your doctor tells you not to, many women can start doing pelvic floor muscle contractions within just a couple days after delivery. These are generally very safe to do, and this is something that can be taught before delivery so that you understand the concept of how to contract and relax those muscles, and then you can start doing it, because we understand that 2 days after delivering your baby, you're not probably going to want to come up and see a physical therapist. You're not going to have time or energy for that. And then most women will start more formal rehab anywhere from 6 to 8 weeks after delivery. We always want clearance from your medical provider to do that, especially if you had a C-section. You do want to get that follow-up and get clearance to start exercise again. But we always tailor what we're doing to the specific needs of your body. And then most women will do anywhere from 4 to 8 weeks of therapy, once or twice a week. So now you know more about postpartum rehab and a timeline for a rehab program. There are so many issues that women develop during pregnancy that they don't realize can be treated. Click the link below to go to our Learning Center to read a variety of women's health articles. There's a wealth of information covering several conditions and symptoms you may be experiencing.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.